Good afternoon, everyone. Thanks so much for joining us. I'm Melissa Dudon, and we have a really great panel for you today to talk about COVID vaccines, the need to get one, and some myths and some other challenges that we're seeing in our community surrounding the vaccine. So I'm really excited to be here with you today. So in February, the state of Nevada announced an equity and fairness initiative aimed at ensuring that equity is a cornerstone of all vaccination efforts. Now, to help with the initiative, the Nevada Vaccine Equity Collaborative was formed by the Nevada Minority Health and Equity Coalition, as well as Immunize Nevada. Now, to tell us more about the collaborative, address vaccine hesitancy, like I mentioned, especially among Black, Indigenous, and persons of color communities, and dispel myths about the vaccine, we're joined by a great panel. We have Dr. Erica Marquez, assistant professor at the UNLV School of Public Health and member of the Nevada Minority Health and Equity Coalition. Dr. Luis Medina Garcia, infectious disease physician from UMC, as well as David Perez, public affairs and community engagement manager with Immunize Nevada. Thank you all so much for joining us today.
Thank you.
Thank you.
So before we start, I want to let everyone know that's watching that this video is actually going to be captioned in Spanish and shared later this week in our comment section. So keep an eye out for that. So Dr. Marquez and David, let's start with the both of you and your work on creating the Nevada Vaccine Equity Collaborative. What is it exactly, and how do you get people involved in this?
Great question. Do you want me to start, David?
Go for it, Dr. Marquez.
Yeah, so we have been doing some COVID risk reduction work for quite some time throughout the pandemic. And as we were heading into the vaccine space, obviously the biggest concern for us is that the disproportionate impact in communities of color. And so how do we ensure that the vaccine distribution and communication has equity in mind as that is happening? So we partnered, the Nevada Minority Health and Equity Coalition partnered with Immunize Nevada to really begin to bridge that for all of us that were involved in the COVID response, because it's not just one institution, but many of us are part of outreach into our communities. And so kind of our main focus is one, thinking about what is an equitable distribution look like and how do we implement that across the state and make sure that we're hitting those communities that have been really impacted by COVID-19. And the other component to that is really thinking about how do we communicate with our communities about the vaccine. One, to address the vaccine hesitancy that we hear about, that we know exists in many of our BIPOC communities of color, but also to think about how do we message, how do we inform them about those concerns, how do we get information into the community? Because that's a really key point. Even if we've developed tons of social media, that may not hit all of our community members. So thinking about how do we be versed in how we get information out. One, obviously social media, but engaging our community partners. And I think that's one of the cornerstones to our effort, is that we want everyone to have a seat at the table. And that includes having our community leaders that help us inform our campaign, and then also help us get that information out in terms of disseminating information. And so that has been kind of our vision as the collaborative and working with Immunize Nevada.
David, do you want to expand on that?
Dr. Marquez really hit the nail on the head. She really gave a good explanation as to how the collaborative came to be. As Immunize Nevada, we've actually been in the state of Nevada for about 25 years, and we really pre-COVID worked on improving vaccination rates all across the state, whether it be back to school vaccines for children or for adults as well. So being able to partner with the Nevada Minority Health and Equity Coalition to kind of fill in those gaps after we identify them is really the goal. And so we're very excited to do that.
Absolutely. And we kind of touched on it a little bit. So Nevada's COVID-19 vaccine playbook, it actually states that vaccine hesitancy is expected. You guys were expecting it to be a huge issue, especially among these BIPOC communities. So what are some of the main issues causing this hesitancy? How can we build more confidence in our community going forward?
Do you want to go first, Dr. Marquez?
Sure. And so part of our initial work, because we knew the vaccine was coming, we did 30 focus groups across the state in many of these vulnerable communities. and we learned a great deal because we knew that we had to prepare for the vaccine was coming, and so we wanted to get a good understanding of what the concerns are. And I have to say that amongst all of our communities of color, the concern about or the vaccine hesitancy is different. So our concerns in our African American community are different than they are in our Hispanic Latinx community or even in our Native American community. And so what we've been trying to do is really take that information to work with Immunize Nevada and develop these micro community campaigns that help inform some of the various issues. And some of this is historical issues with racism, discrimination, unethical research, and those things certainly came up in those conversations. And then other things, and particularly with our Hispanic and Latinx population, is families that are living in mixed status households or families that are undocumented. The concern about being able to go and get the vaccine. What does this mean? Are they somehow being tracked and not going to get it? And so we have been working again in partnership with Immunize Nevada to try to tackle some of these issues to make sure that everyone that wants a vaccine actually is able to get it.
Absolutely. And what about safe places for these communities to ask questions? Where can they go to ask, to have these concerns addressed?
Yeah, so we are actually working on creating what could be spaces for people to either come in or submit questions. Right now, we've been really working on developing resources, whether they be digital or flyers that we can put in outreach events where we can answer some of those questions that are most commonly asked in regard to vaccine hesitancy. So really trying to first create maybe a digital safe space, really being able to participate in panels such as this to be able to answer questions, as it's a little bit safer to be able to address people in a physical setting.
Is there a standard operation or operating procedure when dealing with immigration status, and what kind of information is collected? What do you have to show when you go and get a vaccine? What is or what is not allowed? Does that vary from location to location? What can you guys tell us about that?
I can take a stab at this, Dr. Marquez, and feel free to jump in, but it seems to be pretty standard in the sense that really what's required is some form of identification, and that identification isn't really shared with anyone. That information stays private, but the identification is really kept on hand for those who are receiving a vaccine that requires a second dose, so that they are able to create an appointment for the applicant or the patient to come back for their second dose, and they're able to match up a name and a date of birth to make sure that they're receiving that same vaccine. So there is a little bit of standard documentation required, which we would say is some form of a photo ID. Doesn't have to be a Nevada license or Nevada related at all. And again, that information stays private and isn't shared, but just to help set up that second appointment if needed.
Okay, definitely an important reminder. All right, Dr. Medina Garcia, let's get you in on this conversation. There are a lot of myths, misinformation about the vaccine. So what myths can you kind of help us dispel about, let's talk with the effectiveness of the vaccine, or how a lot of people we've heard have concerns over the quick approval process. So what can you tell us about that aspect?
Right. So one has to remember that never in the history of medicine and never in the history of mankind have we been able to achieve a vaccine as fast as we have this time around. And there's very good reasons for that. One, the technology available is unparalleled. mRNA technology has been around for several years, but the application of that technology to disease processes like this is just had never been done. People are sometimes suspicious of how quickly this was developed, but we have to remember that the research on SARS-CoV-2 and that led to the vaccine being available is built on 15 years of research for SARS-CoV-1. So we didn't start from scratch in investigating this. There's worldwide research on coronaviruses, and we built on that. The reason why this vaccine was able to be produced so quickly is because the scientific community of the entire world focused on a single problem, and the governments of each country that participated in the development removed the risk, the financial risk specifically for those pharmaceutical companies to develop these drugs, right? Essentially, they said, look, we need this so badly that we'll pay for it ahead of time. If it doesn't work, we won't use it. You'll still get paid. So that was a huge factor in making sure that these things became possible. And then the other part is lining up the processes of approval and review of the scientific data in a timely fashion. So usually drug approval processes are long because it has to go through many different instances and many different authorities to move to the next step. So what they did with Operation Warp Speed in the United States was streamline all those things, make sure that the right people were available to review that data, so that they can pass over to the next step. It's really important to underscore that no bars were lowered in the safety and efficacy of these vaccine products for approval, right? They had to meet the stringent standards that they would have otherwise had to meet. It's just the time frame was compacted. So that's how quickly they became available. And then the other part is myths, right? So there's unfortunately social media that is able to amplify negative and false information very quickly. And once that arrow has been released, it's almost impossible to bring it back. And so what I tell people is make sure that you get your information from reputable sources. Look at cdc.gov, look at Southern Nevada Health District, look at the university's efforts and websites to provide true and reliable information for people, and ask questions, right? One of the first myths with mRNA vaccines were that they had a chip in them and that they would be able to, track you and such. And I understand how people could be worried about that. Every time you get on Facebook, you are being tracked and you give them permission to track you. What I can tell you is that the technology to have nano chips and individually programmed to each people is just not feasible and not possible at this point in time, right? So you cannot get a chip from a vaccine currently, and this is certainly not involved in any of the vaccine platforms. Safety is unparalleled. It has been proven to be a very safe product with not just American research, but worldwide research. The numbers will continue to come in the review of that data. For example, Israel is the country that leads the world in vaccination for their population. And the efficacy and safety data continues to just blow us out of the water. There's unpublished data now saying that it not only prevents you from getting the infection, but also prevents you from spreading the infection, which is excellent news. Again, we got to take that with a grain of salt until it is formally peer-reviewed and published in major journals. But it helps you protect yourself. Virtually none of the vaccine recipients died from severe COVID infection. Almost none of them became hospitalized. So those goals have been met and just surpassed by a very long shot. I mean, this is so much better than we expected it to be. For context, the approval rate was going to be 50%. If this vaccine prevents severe illness and death in 50% of the people who receive it, it was going to get approval. For the mRNA vaccine platforms, it's 95% for both the Pfizer and Moderna products. And if you allow me to just give a comment on the other vaccine platforms, the Johnson & Johnson vaccine, which was recently approved for use in the United States, is slightly lower in efficacy, but it is not significantly lower. And I tell people, which vaccine should you get? And my answer to them is the first one that becomes available for you, because they're all safe, they're all effective, and they'll prevent you from getting to go to the hospital. And most importantly, they'll prevent you from dying from COVID. Prior vaccine allergies are really not an issue with receiving the COVID vaccine. If you had a severe reaction to the first dose of the COVID vaccine, then we recommend that you don't get the second dose. But if it was not related to COVID vaccination, no worries, continue to complete the vaccination schedule. A lot of people have been hesitant for vaccine side effects. At UMC, in working with the health district and public health authorities, we have inoculated thousands of people, and it's been very, very well tolerated. To my knowledge, we haven't had to send anybody to the hospital because of a vaccine side effect related issue. And so it's very well tolerated. The symptoms are mostly local, injection site pain, a little bit of a headache. Sometimes people get a fever, but it's very rare. and they usually last for 24 to 48 hours for the most part. So I tell people not to hesitate, get the vaccine as soon as it has become available to you. I tell people, please always keep checking to see when it's your turn. This is such a fluid situation that changes by the minute. I recently found out that if you work in a casino now, you can get vaccinated regardless of what you do at the casino. Restaurant workers, retail workers, and those are all part of the essential workforce that we need to open back up. Incidentally, in regards to equity, a lot of people of Hispanic nature and communities of color also work in those jobs. So it helps us also make vaccine access equitable to people. And I've said a lot. So if you have specific questions, I'll be happy to answer them, but I'll give the ball back to you guys.
Well, I actually just wanted to expand on one thing you said, just for clarification for those who are watching. If you get the COVID-19 vaccine, it's not guaranteed you won't get COVID-19. Is that correct? It helps you not be put in the hospital, helps you not,
Correct.
Okay.
So nothing is 100%. If you look at a 95% efficacy rate, that leaves a 5% chance that you can get COVID. What I tell people is, look, think of every exposure as a 5% risk of getting COVID, right? So that doesn't let it leave your mind. Continue the social distancing measures, wearing masks. There's new guidance from CDC about getting together with groups of people that have been vaccinated. It's a bit complex and long to talk about it today, but things will get better. And the more people that can get vaccinated, the quicker we can get back to what life used to be.
Absolutely.
And so for equity and access, in spite of all these issues with hesitancy and conspiracy theories and such, I think it's really important to just go out there and offer it to people. And when they say no, to say, okay, we respect that. Is there something that we can answer for you that would help you change your mind? And in my opinion, at least for the Hispanic community, they want to see other people that have gotten it to say, okay, I'll jump into the deep end of that pool. And so
absolutely,
the only way to get through that is to have more people vaccinated. And the only way to do that is to give them access to it and go to where they are. And so social media is a very powerful tool, but I think we're underutilizing the mainstream media, like newspapers and the news. People do watch the news still. And that's a way for us to be able to get that message across from reputable sources of information, and to say, look, I gotten it. My parents gotten it. They did just fine. And it gives you peace of mind to be able to get back to your customs, right? Hispanics and African Americans are very family oriented, and we really cherish being together. And we miss that so terribly. This is a tool that can help us get to that place where you can hug your grandkids again.
Yeah, absolutely. And David, I want to go to you and Dr. Marquez on this, because the state came out recently saying you really need to reach out to your family and friends, see if they need help with this process. What can you do? Talk to them, maybe lead them in the right direction. They might not know where to go. I mean, what do you guys need to see to get more of these BIPOC communities vaccinated?
Well, I'll go ahead and go first. I know that with the recent opening of the lanes and the discussion of the lanes and seeing who's available, we've really been wanting to reach out to those that are 65 plus. I know recently it has opened up to 55 plus who have underlying health conditions, but really reaching out to our family members, our community members, our neighbors. If there is someone that we see that does fit in that age group and they need some assistance getting to an appointment, making sure that we can help them. It may be difficult to call the number or to set up an appointment online. So being able to do that for them, walking through the process, doing a little bit of the research for them and letting them know how it's going to pan out once they get there. And even giving them a ride there to make sure that they get there, get the assistance they need, and then can get back home safely as well.
Okay, absolutely.
So be a vaccine evangelist.
That's a very good way of putting it. I like that. So let's see if we have any questions from our viewers. Let's see. Let me just check in. I don't believe we do. Okay, I'm not seeing any questions coming up. Before we close, is there anything else you guys would like to add or you want the public to know, especially these BIPOC communities, about getting vaccinated during this time?
Don't hesitate. Do it. This is yeah, and I understand like the cultural background and they mentioned unethical research in the past, but think about it this way: the privileged population is doing whatever they can to get a vaccine. So if the wealthy want it, you do too. Make yourself protected against this terrible disease. Protect your family's future, your ability to work, your ability to care for them, because that is everyone's right, and we're trying to make it more equitable for all of us as a nation.
Very well said. All right, great
Yes.
discussion. Yeah, David.
Oh, just if I may add, just I know that all three of us had touched on it before, but just to make sure you're incredibly, careful and knowledgeable on where you're receiving your information from. So, any resources offered by UMC or Immunize Nevada, nvcovidfighter.org, the Southern Nevada Health District, all have incredible resources as to where you can access the vaccine and background information about it as well. Just because we know that misinformation can spread just as quickly, if not more, than COVID-19.
Right. I mean, we all love a good social media story, but we got to figure out the truth behind some of those social media posts. We can't just take everything at face value. It might require making a phone call, doing some additional research, right?
And I remember at the beginning of the pandemic, Dr. Ghebreyesus, who is the head of the WHO, said that we were fighting two pandemics, one against COVID-19 and the other one against misinformation. So make sure you get your info from reputable sources.
Absolutely. All right. Well, thank you guys so much for joining us for this really important discussion and getting the word out about getting the COVID-19 vaccine. I appreciate it. And I just want to remind everyone that's watching, you can get some more information, to schedule an appointment, go to nvcovidfighter.org, or you can also call 1-800-401-0946. You can jot that number down. That call center is open from 8 a.m. to 8 p.m. 7 days a week. So definitely valuable information you're going to want to take advantage of. Thank you all so much for joining us today.
You're welcome.
Thank you so
Have a
much.
great day, everyone.